Hi, Women's Health class. These are my friends Solomon and Melissa, and this is for a project, PSA project for women's health. So go ahead.
Well, thank you for inviting us for your project. We're very great to be here to help out. So I was saying earlier that I thought that the topic that could be interesting in discussing today is sexual health, and stuck to that is oral health. That I think is also important because from a man's perspective, what can impact his life, I would say, really is something related to his direct contact with a woman. And direct contact with a woman implicates oral sex. I mean, sorry about that. Oral health, I wanted to say. And also anything related to STDs. First of all, because STDs can impact not only the woman's health, but it also impacts male in the sense that he can get the disease from the woman. And also long-term consequences can be not being able to have kids, sterility in the long run. So I think it's a very interesting topic, especially here in Omaha, because we are one of the leading states in terms of STDs in the United States. And it's very important to act upon that, I would say, that topic, so that people or women in general know that important to get tested, because it's very cheap, easy to easy to get done, and easy to treat. Most of the time, it's just one single treatment, one single intake of medication, and it's over. So that's what I think would be a very interesting topic that we can discuss. I don't know what you think, Melissa.
No, I agree. I agree that's an interesting topic, especially for STDs and how it relates to the younger population, and how then that kind of relates back to the relationships we have, and how to, so you're posing the question of like how should we get people involved, and how do we proactively get tested? And so you're bringing up the question of how do we date, and how do we build these relationships when we're going to come into contact with STDs or with people that could potentially have STDs. And I mean, I think it's a very valid question. I mean, I haven't dated a lot of people, and even myself as a young adult. I mean,
really?
Yeah.
Okay.
Yeah.
Put a number on that.
But it's true. I mean, it's a hard place to be in, and it's hard to start these kind of conversations with your potential partner, or the people that you're dating. I mean, I don't personally know exactly how to start the conversation, and I don't know if I just need to be more comfortable with the topic at hand. But it does pose a very interesting question in how we deal with it. Like personally, yes, I'm aware I would be tested. I understand I go to the doctor every year, this, that, and the other. But how does that relate to how other people take care of themselves? And how do I ask the right questions? Like that's completely new to me, and that's me being honest about it. So, and I don't know how you would approach it as a man.
Well, I really don't have much issues about bringing on the table getting tested before doing any type of sexual contact, because I came from I would say a country or continent where HIV, for example, has high rates.
Yeah.
And being a physician there, I have treated many patients who had the disease. I came into contact with many patients who had the issue, and you don't want to get there. So I think being proactive, just bringing it readily in the discussion before doing anything is important. And I don't see why anyone will have any issue doing that. And if the partner is reluctant, it means that that's something that's not clear, and that's where you even need to push harder and probe it more. So I think it should be just part of the conversation during the time you're just dating. Just bring it up and see what's the other's mindset about the issue, about the testing issue, about STDs, about wearing condoms for intercourse. And I think from there you can have a hint of if something fishy is going on and if you need to run away or if you really need to get that test done before anything. So I think as adults, it's not an issue. It might be an issue for, I would say, younger folks, teenagers, for example. I don't know what's the real environment there, but sex can happen anytime before you even, go through that dating, I would say, part of the thing. And I think this is where our role as public health professionals come in to raise awareness in places where we need to do, schools, youth centers, to let them know what they should be expecting or how they could handle the situation before getting into a relationship or getting into sexual intercourse without being exposed to risks. That's what I think.
So I have a quick question.
Yeah.
So is it easier for a male to initiate sexual testing, the STD testing, than for a woman? Do you think as a man, you said it will be like a deal breaker if you say that, but as a woman, do you think, say